Thanks everyone for joining us once again for another edition of the Chapters Health System COVID-19 Q&A. Joining us this week, our first ever recurring guest, Dr. Stewart Stein. He's the Vice President of Medical Services here at Chapters Health System. Dr. Stein, thanks so much for being with us again.
Thank you very much. Appreciate the opportunity.
Yeah, so it's been 6 weeks since we started this video series. A lot has changed over that time. Today, want to talk a little bit about where we are as far as testing goes and kind of how has that changed in the last month and a half?
Well, I'm sure everybody recalls initially we had the original PCR test that involved using a nasal swab that went way back into the nasopharynx and got twisted around and sent off to a laboratory. We heard all about the shortages of those swabs. We heard all about the laboratories not having enough reagent supplies, so they couldn't actually run the test. And then we also heard about the problem with the personnel who were obtaining those tests having to put on full personal protective equipment every time they got one of those tests, so it was really burning through our supplies. And while we're still doing a lot of those tests, the shortages are much better than they once were. The tests have become much more available. We have the swabs. The labs generally have the reagents that they need. But there have been some developments in testing. There's a newer version of this same PCR type test, the one that actually tests for the virus itself. The latest one involves collection of a saliva sample. If anybody has ever done the Ancestry DNA test, it's the same type of thing. You collect a couple of milliliters of saliva and send it off to the laboratory. This doesn't require anybody to be in full personal protective gear to obtain it. It doesn't involve a swab going way back into the back of your head. It turns out that the accuracy, the sensitivity, and the specificity of this newer test is actually superior. So these are becoming much more widely used. On the forefront, in the future, we expect to have other testing options. Antigen testing is something that is in development, and what that does is it looks for a piece of the viral particle, in other words, a protein or DNA sequence. It does not actually test for the entire particle, but at this point, those are not in practical use yet. I'm sure everybody has heard all about antibody testing. I just heard on a news report this morning, or saw in an article, that Madonna announced that she was going to be going out onto the streets because she tested positive for the antibodies. So there are multiple tests available now that will test for the presence of antibodies to the virus. Anybody who's come to work at Chapters has probably had a similar test to make sure that we had immunity to rubella and measles and all of those types of things, hepatitis. But there are a lot of unknowns with this new antibody testing. First of all, not all of the newer tests are actually 100% reliable. There's a high false positive test with some of them because they've really been rushed to market. In addition, even when we get reliable tests, and I think we're close, they're being studied as we speak, but we're still going to have the issue of what do we do with that information. We haven't really proven that somebody who has a positive antibody test is incapable of getting reinfected. In fact, there are cases now where people have reportedly had the virus, recovered from it completely, and now have it again.
Turnaround time when testing first began was somewhere around 7 to 10 business days. Some people weren't getting results for almost 2 weeks. Has that improved?
That's improved considerably. The turnaround times now, we've contracted for our testing with a local hospital. We get our results within 24 hours. There are actually newer tests out that can give results within an hour. And so we're going to be seeing more of those. The reliability of those has been called into question, so we haven't jumped on the bandwagon just yet. But still, we're very happy with the 24-hour turnaround time. So.
All right. And again, when testing first began, you might have needed a doctor's note. You would have to wait in these long lines to get a test. We've seen the footage of the cars outside the football stadium. Now, some cities and counties have said anybody who wants a test, come on down and get one. Locally here in the Tampa Bay area, what's the latest there?
Well, until recently, that hasn't been the case here, unfortunately. But fortunately, just within the past week, a local hospital group has set up testing sites that allow people to be tested. And they don't have to meet this rigid set of criteria. They don't have to be greater than 65, have multiple medical problems, have fever and cough and shortness of breath. They can just want to be tested. Now, I'm not sure that's terribly valuable if you haven't had a particular exposure and you're feeling well. I don't know why you would want to be tested. However, in many instances, we need to be tested. For example, hospital workers may need to be tested so that they can be comfortable they're not infecting other people. In addition, we've had instances of people who have had exposure and don't know whether they have to quarantine or not, because they don't know whether that exposure has resulted in an infection that just hasn't become apparent yet. So as of today, you can actually just go online and sign up for one of these tests. You don't have to have symptoms, and then you simply go to the test site and they give you the little cup to collect your saliva. So yes, anybody can get tested right now.
All right, good to know. Switching focus now to sort of the treatment of the disease if you test positive. What have been some of the developments on that front in the past 6 weeks?
Well, as you know, in the beginning, of course, everything was being looked at, and that's what drug companies usually do when there's a new villain out there, a new virus, is they take everything off the shelf and try to find something that they've already got that might work. So we heard a lot about things like hydroxychloroquine, which it turns out wasn't helpful. Not only was it not helpful, it actually increased the death rate. So I don't think we'll be hearing a lot more about that. But there was a viral agent, remdesivir, that had actually been developed to combat Ebola and other RNA viruses. It unfortunately did not work for Ebola, but of course they tested it, and we now have data that shows that it decreases the duration of hospitalization for seriously ill COVID-19 patients by several days. Studies, the information that we have is based on small numbers so far. A lot more work needs to be done, but this is very encouraging. We don't really know with certainty that it has an effect on mortality rate. It probably does. If it's going to reduce hospitalization duration, that means it's combating the virus. What's very, very important about this, though, is that what drug companies will now do, what they typically do when they find something that works, is they take it and they quickly try to improve upon it. We saw this with the development of drugs during the early years of HIV. First, there was one, and then there was a whole family of them that were based on that one but improved. And over time, that turned from a fatal illness into one that's completely manageable. I expect we're going to see the same thing. We have our first drug that has demonstrated efficacy, and I think we'll see that drug improved upon in the coming weeks to months.
All right. Well, Dr. Stein, thank you. It's nice to finally share some good news. So it seems like we're hopefully trending in the right direction. Hopefully 6 weeks from now, even better news, and I can give you a call again, and we'll do this one more time.
I look forward to that. Thank you very much.
All right. Thank you, Dr. Stein. And thank you, everybody, for tuning in once again, and we will see you next week.